I do a lot of buccal fat pad videos, as you know, and because you guys like them, I keep making more. So first of all, I want to thank the person who told me I don't need buccal fat pads removed because I look good. It doesn't really change the way you look significantly, but there are areas, and on me it's right here, and I don't like that shadow, and so I think I would be a good buccal fat pad candidate, but I do appreciate the compliment. The interesting thing about buccal fat pads is not so much the size of the buccal fat pad, it's kind of how it presents on a different person. So skinny people in general have this, or people with skinny faces like mine, have the same sort of buccal fat pad volume as heavier set people. It seems really surprising, and it seems like if I gain weight, will my buccal fat pad be bigger? No. There is a shocking consistency, and of course there's some variability, but there's a shocking consistency across genders, ethnicities, and basically BMI, or how heavy you are. So when people lose a lot of volume or weight in their face, it doesn't mean that the buccal fat pad itself is going to go down as well. It's a very stubborn area, if not impossible to lose completely. And it is a structure that, again, is very consistent. And to sort of prove this point, I want to play a little game today. And I want to show you 3 faces, and you can assess these faces, and you try to determine, of these 3 faces, whose buccal fat pads are going to be the biggest and whose are going to be the smallest. The first patient is a 25-year-old Latino male. The second patient is a 28-year-old Latina. And the third patient is a 31-year-old Filipino male. Whose do you think is the biggest? To remind you, the buccal fat pad procedure involves making a small incision on the inside of the mouth, on both sides, finding this buccal fat pad, and specifically the buccal body of the fat pad, removing it and carefully controlling any bleeding, closing the incision, and carrying on with your day. We have an opportunity after the fat is removed to assess and quantify that fat. One thing I've noticed after about 250 procedures is that this fat quantity is shockingly consistent. Check it out. Okay, starting with patient number 1. These are the 3 views to consider when trying to estimate how big the buccal fat pads are going to be. The operative approach is the same for every single patient and involves a small intraoral incision, meticulous dissection, and careful control of bleeding. I generally start on the patient's right side and follow up with the left side. This is how they look when they come out. The second patient, again, same operative approach, same combined procedure of buccal fat pad removal and some neck refinement. Again, starting on the patient's left side. And following up on the patient's right side. Buccal fat pads here are pretty similar. Last but not least, the third patient, who has arguably the skinniest face. Do you think his buccal fat pads are going to be the smallest? Starting on his right side, you can see the same meticulous dissection through a tiny little opening. Control of any source blood vessels to the buccal fat pad, and removal of the buccal fat pad body in its entirety. Start with the left, finish with the right. And his are by a fraction of a cc the biggest. So in summary, the first patient's buccal fat pad volume average is 4.5 cc's. The second is 4 cc's, and the third is 4.6 cc's. So they're all pretty consistent and unpredictable. It's more how they sit in your face than the absolute volume themselves. So as you can see here, there is some variability in the assessed volume of these fat pads. But it's not so much the size of the buccal fat pad, it's how it harmonizes and interacts and plays with the other structures of your face. That's what's important about buccal fat pad surgery. While some people may not seem like candidates at all, depending on what your goals are, if you really want to slim or streamline certain areas, this procedure can help you. Other patients who have huge buccal fat pads have very subtle results. Patients who have seemingly small buccal fat pads have more drastic results. So again, buccal fat pad is a consistent volume. The way it interplays with other facial structures is what varies. I would love to see you for a consultation. Don't hesitate to call us at 949-432-4730. And of course, be sure to subscribe to our YouTube channel so you can get more answers to questions like this and more.